Your arms and legs feel tingly again. Your eyes start to blur, and you see spots and colored flashes. Now you feel lightheaded and smell strange odors. You have been here enough to know what's next. You are about to get a migraine. You know how they start, but have no idea why you get them. What makes you more likely than some other people to get these awful headaches? Chronic migraine is a distinct disease, and if you have it, you are living with at least 8 migraine days per month. A total of 15 or more migraine and headache days per month. That is half of each month with migraines and headaches. Nearly 2/3 of people who are living with chronic migraine have not been properly diagnosed, based on a study of 200 people who saw a specialist. Chronic migraine is a time thief, causing those living with it to miss an average of 63 days of work, school, and family time over a 3-month period, including time that is less productive. A migraine is a powerful headache that often happens with nausea, vomiting, and sensitivity to light. Migraines can last from 4 hours to 3 days, and sometimes even longer. Migraines are not the same as regular headaches, tension, sinus, or cluster headaches. All of these types of headaches cause pain, but a migraine has additional warning symptoms and signs, such as feeling irritable and depressed, visual disturbances, also known as auras, nausea and vomiting, and sensitivity to light. Migraine pain is usually unilateral, meaning that it occurs on only one side of the head. The real question is, why do people get migraines? Doctors are not totally sure what causes migraine headaches, but they think imbalances in certain brain chemicals may play a role. But there are many potential causes of migraines. The exact cause of a migraine may not be fully known, but here are a few common ones. 1. Genetics. If someone in your family gets migraine headaches, you are more likely to get them than someone without that family history. Studies suggest that half of the risk for migraines comes from your family history. 2. Certain foods. Salty, processed foods and aged cheeses like blue cheese are known triggers. The artificial sweetener aspartame, and flavor enhancer monosodium glutamate, caffeine, chocolates, cured meats, and anything with a strong smell may also cause migraines. 3. Age. Migraine headaches can hit at any point in your life, but you are more likely to get your first one in your teens. The headaches tend to peak in your 30s and become less severe later in life. 4. Nerve signals and brain chemicals. The trigeminal nerve, located in your head, runs your eyes and mouth. It also helps you feel sensations in your face and is a major pathway for pain. When your serotonin level drops at the start of a migraine, this nerve may release chemicals called neurotransmitters that travel to the brain and cause lots of pain sensations. 5. Hormonal changes. Shifts in the hormone estrogen can bring on migraines in women. Medications like birth control pills or hormone replacement therapy can bring on headaches or make them worse. In fact, women are about 3 times more likely to get them than men. 6. Stress. Perhaps the biggest culprit of all, stress, is a trigger for almost 70% of people with migraine. This is because when you are stressed, your brain releases chemicals that cause a fight or flight response. This may cause an increase in blood pressure and increase blood flow to the brain, causing a migraine. Anxiety, worry, and fear create even more tension and make the migraine worse. 7. Alcohol and caffeine. Do you ever get a raging headache after a glass of wine? Alcoholic drinks and drinks high in caffeine can be very good migraine triggers. Many people find their migraine symptoms are heightened after consuming caffeine or alcohol. Conversely, other people say that a cup of coffee can stop their migraine symptoms, and some medications designed to fight migraine pain may contain a dose of caffeine. Although migraine patients consider red wine the principal alcoholic migraine trigger, studies show that other types of alcohol are just as likely, and sometimes even more frequently, the culprit. 8. Changes in weather and sleep patterns. Storms, excessive heat and changes in barometric pressure are common weather-related migraine triggers that can lead to a migraine attack. High humidity and heat can easily lead to dehydration, another common trigger. Also, if you get too much or too little sleep, you may get a migraine. 9. Sensory overload. Bright lights and loud sounds can bring on these headaches in some people. For many migraine patients, natural light is the enemy. This condition is called photophobia, and it is actually one of the criteria used to diagnose migraine. Both natural, bright light and fluorescent or flickering bulbs are problematic, making it difficult to spend time outside or be in an office environment. 10. Strong smells. Some odors may activate certain nerve receptors in the nasal passages that may trigger a migraine attack or make worse one that already started. Osmophobia, aversion to odors, is a common symptom of migraine. 11. Medication overuse. If you have migraines and take medications for them more than 10 days in a month, you may be setting yourself up for what's called a rebound headache. Your doctor will probably call it a medication overuse headache. If you have medication overuse headache, you must first stop taking the medication and clear it out of your system before you can stop the cycle of pain. While you might not be able to prevent migraine triggers altogether, there are some simple things that may help you stop them before they start. We will be looking at these in our next video. Thank you for watching. If you have not subscribed to this channel yet, hit the subscribe button below and be the first to watch our next video.